You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what you need to look for in a dentist that is going to be placing dental implants. With us, we have a clinical instructor from the American Academy of Implant Dentistry, also past president of that organization, runs or is part of the largest maxi course, training course for dentists in the country. With us, we have Dr. Minichetti. Dr. Minichetti.
Thank you for having me on.
Did I leave anything out?
No, you didn't. No. I think you got it all. I actually run both the New York and Las Vegas American Academy of Implant Dentistry maxi course. Those are 300-hour programs designed to train doctors in implant dentistry comprehensively. They provide lectures, they provide world-renowned speakers, and they provide lots of hands-on experience for doctors to get them credentialed, to prepare them for credentialing with the Academy, which shows that they're qualified to place implants in the public.
Okay, now, you know the Wellness Hour, we've been airing on television for now, going on our 20th year.
Yeah.
And this is probably the first discussion we've had with what to look for in a doctor.
Okay.
Now, the American Academy of Implant Dentistry is really the recognized leader in this in the training.
It is. As the American Academy of Implant Dentistry mission statement states, we both educate and credential doctors in this discipline. We're the oldest organization in the discipline, founded over 60 years ago, and we have our own separate board, such as the other specialists in dentistry. We have the American.
So this is the only recognized board for implant dentistry?
Correct.
Really?
It's the American Board of Oral Implantology. It's our boarding organization, separate from the Academy, and it's been recognized in several states as a bona fide credential for specialization in implant dentistry.
So do you believe, or do you have a bias that if you're going to get this done, go to somebody that's been through this AAID credentialing process?
We have specialists from other fields such as oral surgery, periodontics, prosthodontics, American Dental Association recognized programs. They come to our board, they present their knowledge in implant dentistry, and now they're boarded in that specialty.
Okay, because there's a lot of guys doing implant dentistry, right?
Today.
Is this true? You could be like a general dentist.
Yes.
Take like a couple day, 2-3 day course, and you're doing it on Monday.
Yes. I mean,
does that happen though?
It can happen occasionally. Some doctors will practice that way. It's not something that we would recommend. We recommend a more comprehensive educational approach. These doctors, think about it, are dedicating 300 hours over a year. A lot of income is lost by a lot of travel time from their family. It's a big commitment on their part, only to provide the best treatment for their patients. Okay, good.
Now we have on Skype a Dr. Martin Pock, who is taking the course.
Yes.
Tell me about that. He's a younger dentist. Yeah. Is this the next generation of
super young guy, smart. He looked into taking courses because he wanted to provide implant dentistry for his patients. He's been out of school 5-6 years, and he decided to sign up with our Las Vegas American Academy of Implant Dentistry course. We run it out of the dental school, University of Las Vegas, Nevada, and he's gung-ho. He's learning proper training, and we should talk to him.
So Dr. Pock, welcome to the program.
Hey Randy, thanks for having me.
Now, we put this interview together for patients. So why did you get involved in this maxi course and learning it at this level?
Okay, well, I really wanted to get into implants, and I started off doing those weekend courses. I just did not feel the confidence to offer my patients and confidently tell them that, hey, I'm going to do this procedure for you, and I'm pretty competent doing it. I just couldn't offer it in that way. I knew that I needed something comprehensive, something that I can be truly competent in doing such a procedure. It's more of a confidence thing for me to know that I can offer the best quality of care for my patients.
Do you also have a bias where you believe that if you're going to look for a dentist that's doing this, they should be involved in this American Academy of Implant Dentistry?
I think so. When you get your dental license, you're licensed to do implant dentistry. That can be through, a weekend course, maybe even YouTube. I don't know. You could be a YouTube warrior or a weekend warrior, something like that.
Did they teach you this stuff in dental school?
Very little. They teach you very little, maybe the restorative part, but not the surgical part of it.
What does that mean? They taught you how to put the tooth on top of the implant?
Correct. You send the surgical part off to an oral surgeon or possibly a periodontist, and they come back to you for the restorative phase.
So how are you going to let people know that you've had this additional training?
Right. It'll be on my website just to show that, I am credentialed, I've been tested, I've been challenged on these things, and I know what I'm doing.
Okay. Well, Dr. Pock, I want to thank you for coming on the program.
Thank you.
And Dr. Minichetti, because so many of what dentists do is, the perception is like commoditized. They believe that you're all doing it the same way, right?
Right.
So what are you doing to get the word out to patients to look for somebody that's been through the AAID training?
Well, working with our academy, actually, we have a marketing department that's going out to the public, telling them to go to the website to look for credentialed members. This way they can find a doctor who is well versed in all aspects of implant dentistry.